It's not that bad about Europe. Would you stop complaining about that? It's totally fine. Oh, sorry about that. I'm just joining, somebody for their self-quarantine, talking about things. And also, I'm going to do a Health in 2.0 here from the Oval Office. Don't you love having him back there? It's just great. I feel like he's just like there ready to chime in at any moment with like news and information. Immune to information. That's what I've heard.
I'm amazed he hasn't got his phone there and he's not tweeting, but
Not yet. Just wait for this episode to keep going. Okay, so we have a ton of stuff to cover. So we have a quick little announcement about some stuff that's going on with coronavirus that you're going to make. And then we have another announcement about an event that's taking place. And then we will talk about our deals that have happened in our rapid fire 2-minute question and answer session.
On non-COVID-19 deals. Okay.
Right.
Before they all become COVID-19 deals.
Oh my God. Okay. So tell us give us your coronavirus update. What's going on? All right.
So two quick things. First thing is that ton of activity going on with digital health companies trying to figure out how they can help with this. I've seen announcements from AilDaid, Conversa, ton of other companies are doing stuff in this area, BrightMD, a bunch of others. Catalyst, which is the organization Indu and I run, will be trying to figure out a way to present some of that, hopefully releasing something maybe even as early as this weekend or early next week, where we'll be able somewhere people can collect information about all the things that they're doing. So that's number one. Number two, for those of you watching this on Friday, today, delayed from Monday, is the FHIR-related, no jokes please, Mr. Massa, FHIR-related HealthDevJam online, put on by Adam Culbertson and Megan Antonelli. I should be sharing the screen now, with also Shahid Shah. And if we click one over, Indu Sabaya, my co-founder there. A lot of great people on that. It'll be at 1 p.m. Eastern time on Friday the 13th. It was Thursday the 12th where the world fell out of bed. Hopefully the Friday the 13th will be better. And 1 p.m. Eastern, lots of great people speaking. It's e-patient Dave, Grace Cordovano, Graham Grieve, Australia's national treasure.
Treasure in Australia.
Absolutely. Mark Scrimsher. A lot of great stuff there about FHIR. So for those of you interested in that,
awesome.
On there tomorrow. And you can find it at HealthDevJam.com.
Great. Thank you.
All right. So that's the announcements. And we can probably go do some business.
Let's do this. Oh, my God. So many deals. It's like it's lost, though, in my feed. All right.
Well, there's a whole lot of stuff about COVID-19 and coronavirus and what the hell it's doing to the world. And none of it's good.
Not pointing any fingers, but, Anyway.
All right. You ready?
Love having him back there. I feel so powerful. Okay, ready?
Go.
Okay, RubiconMD raises $18 million. This company's been around for a while.
Yeah, Gil and Carlos, they've been doing this. It's an eConsult company, basically store and forward from primary care doctors, enabling them to get data and information about their patients right in front of specialists and getting them back. Pretty cool. Some other companies doing that as well. Sitka in Bay Area does that. AristaMD down in Southern California, but it's a neat product.
All right, Lyra gets a chunk of change, $75 million.
Yeah, I think they're like 170 now. My former colleague, Connie Chen, is the medical director there. Lyra, interesting company. They've been casting around. They look like they're going whole hog into both providing access to behavioral health therapists, psychiatrists, counselors, the rest of it, as well as tools for people to self-care. A lot of money. I'm not sure they've justified it yet. They had about 40,000 people use the system last year. Doesn't sound like a lot for coming through that much, but hopefully they'll be growing now fast.
All right, Fruit Street gets $17 million from an unlikely source of people.
Bunch of doctors, right? This is a company which has got money from doctors over the course of its history. It's been doing this, diabetes prevention program stuff, kind of like a martyr. Hasn't quite shaken the trees yet, but they're still growing. Hold on. All
right, what about b.well? They get $16 million.
Andre Christian Valdez and b.well, not a personal health record. Absolutely. Exactly. Okay, it's a digital platform in which people are going to do something that's going to help them manage their overall healthcare, but they got some money from UnityPoint, which is the venture arm of that big Midwest Iowa-based hospital system. It's a really cool thing. Hopefully it'll work out. It's a tough area.
All right. CVS Health announces that it added 5 digital health companies to its point solutions management system, which basically puts them into the space of being included by the PBM. So we saw Livongo in there, Hinge Health, Hello Heart, Torchlight, and Will get added.
I don't know what's that. You just said what it was. Next.
All right. Tell me about Sanofi and the sneaky stuff that happened that's been uncovered.
Uncovered by Brian Dolan. If you don't get the E&O, which is not the exit, and I think it's not the Eastern and Oriental, it's the exit and outcomes newsletter from Brian Dolan. You should go. You started Moby Health News. So he's discovered by snooping on the Sanofi filings that they sold about 30. They own half of Onduo, which is kind of like the Livongo, a modern competitor that hasn't already got off the ground. The other half is owned by Verily, part of Google, Alphabet. Sanofi got rid of they got paid for about 60% of their half share, so 30% of it. Verily bought that back from them, paid them about 120 million. For some reason, it was their own Dexcom stock. I don't understand how that worked out. But originally, they put in 500 million for their half share. Okay. So what they were given, like, their share was valued at like 150 million roughly, which means that Onduo, which was valued at $1 billion, it's now valued at 300 million, suggests it's not doing so well, which it's been really slow to get to market. Maybe it'll get there, but I think it's going to be a real struggle for them.
Wow. That's some good detective work there.
That Brian did, but we'll take credit for it.
No, I'm not. Brian should we should tap Brian for I don't know, all things coronavirus here. We're tests.
He actually sent out his newsletter this afternoon and said there'll be nothing about the coronavirus in this apart from the line saying there'll be nothing about coronavirus. We've done an almost coronavirus-free episode about the deals. That's going to change because people...
Other than the shameless plugs you had at the beginning of this.
All right. And the shameless plugging that you did of yourself.
I'm surrounded by the shamelessness here.
He hasn't moved in 4 minutes. Is he okay?
No, wait, let's just see how he's...
Is his quarantine... is his quarantining going to involve him doing the statue thing?
No, he always looks like that. He's fine. He's thinking about what to say next. He's coming up with his next tweet.
There's no teleprompter. It's going to be in deep trouble.
Health in 2.0. Done. All right. For those of you who would like to follow along with us on Twitter, and this guy, he's at The Real Donald Trump. I'm at Jess, and that, of course, is at BoltyBoy. You can subscribe to receive these cute little Health in 2.0s and get them directly delivered into your email inbox by going to thehealthcareblog.com and subscribing to our newsletter. Mr. Holt, stay safe over there.
I'm still got a bit of a chesty cough from HLTH in Vegas in October.
Yeah, well.
Maybe we can blame Jonathan Weiner and Rick Scarfo for coronavirus. No, it's not their fault. All right, we'll check.
No, not their fault at all.
All right. Okay.
All right. Thanks, everybody, for watching. We'll see you guys soon. Bye.